Davangere, right, sir?
Yes, sir.
Yeah, this is LV from Davangere, so he's very much with Karnataka. He's practicing in Delhi. And next up, we will have Dr. Prajwal Shetty, who is our in-house radiologist, talking about the differences between IUP, OPG, CBC, when and where, what is applicable, and how we describe it. And finally, last but not least, I'll be talking about how to handle medical emergencies in the dental clinical scenario. Go about the handling of medical emergencies. So, without much ado, we will start the today's program. Dr. Amit Garg.
Yes, sir.
Over to you, sir.
Okay. Thank you, Dr. Syed. Thank you very much for giving me this platform to raise the awareness and also the raise the skill of our colleague doctors regarding management of medical emergency in dental clinics. So this may be not the routine happening in the clinics, but it may happen and it may hamper your practice, and some situation it may hamper your name also. And also for the safety of the patients, we must keep learning and keep updating ourselves with the skills to manage the medical emergency. And the topic we are dealing with today is drugs in dental clinics that should keep for managing medical emergency in the clinic. So I welcome you all, first of all, and good evening. I'll be taking the drugs not directly one by one, like atropine, ADR, not like that. I'll be talking drugs as per management. I'll talk about asthma a little bit in detail. Dr. Syed will be taking like allergy and the management using those drugs, so that it will be interesting for you and not like studying the pharmacology. And you will be able to make a picture. If that particular patient present to you in your clinic, then you will be able to use those drugs with the ease. So first of all, let's see.
Sir, it's power short. It's 1 minute, sir.
Okay.
Just on the generator.
Okay.
Is this audible?
Yeah, it's audible.
Can you see me? Can you see me? I am able to hear you.
Yes, sir. Yes, sir. You can continue. Yes, sir.
Yeah. I am able to see you and hear you also. So first thing is allergy. So as we are daily dealing with the surgeries as anesthesiologist in corporate hospital, we do give test dose for the main medications like antibiotics. So in dental clinics, you use mainly local anesthesia. For at some point of time, you may not be able to prick the patient before pricking at the dental route. So if the patient presents with the allergy to any of your drug, like some oral maxillofacial surgeons give injections like Voviran also, IM, and that can be very serious allergy issues. Local anesthesia you use, that can also lead to the allergy. Methylparaben is there in your local anesthesia, xylocaine. So that those things are mainly that can lead to the allergy. So allergy can be from very mild thing, rashes and a little bit of cough, to redness, to a very deadly anaphylactic shock. So mainly drugs we need to be equipped and we need to be aware about if such scenario happens in your clinic. So one thing is theoretical part, another thing is what we do in a routine practice. Theory says drug of choice in allergy is adrenaline, but as an anesthesiologist also, in very rare situations, I use as the first drug of choice adrenaline, because allergies we come across are usually mild, and when it goes to severe anaphylaxis type thing, then we come to adrenaline. So first, if some rashes appears, some patient complains of itching, and some patients complained of cough also. They cough severely, like they are going into the bronchospasm. So you know, as a dentist, you must have also seen the allergy thing. So management part comes, you need to give steroid, anti-allergics, and the adrenaline. These are the three drugs that you should be using to treat the allergy. So steroid available in our kit and is routinely used for allergies, hydrocortisone, injection hydrocortisone. It comes in powdered form and the distilled water comes along with it. You can dilute it with 2 to 3 ml and give to patients IV. So that steroid will help to reduce the edema of the airway. That edema only can lead to the deadly complication. So first your target is to decrease the edema. So you gave the steroid. And the other thing is anti-allergic. The allergic thing that is going and histaminic release thing is going on. You have to stop that. For that, injection AVL is there that contains phenyramine. So anti-allergy thing that will cover. Take care. So you gave steroid, you gave anti-allergic, but things are not looking good. And then you have to jump to adrenaline. So adrenaline is such a drug, you can't just give IV directly, so that it will lead to shoot up the BP, tachycardia, and severely cardiac compromise. So recommended is take half ml of adrenaline and give IM. Just half ml of adrenaline is enough to control the situation until any ambulance or help arrives to you. So if allergy happens, you have to give steroid, anti-allergic. If things are not in control, then jump to adrenaline without wasting much time. Try not to give IV directly. Either use IM half ml, that will be enough. If things are not in control for another 4 to 5 minutes, give another half ml of adrenaline. So steroid, anti-allergic, adrenaline. We have given two choices in our kit. Some people are not very confident about cannulation or giving injection. So we have steroid in the form of tablet prednisolone, that is a steroid, and tablet Avil. The same thing, the injection we gave, we have provided in the tablet form also. So if some patient is just complaining of mild rashes and he's saying I'm feeling allergic to the this thing you have given, so you just can give a tablet of Avil and tablet of prednisolone. Okay, that will take care of the milder things. No need to give any injectable. So that covered your adrenaline part in medicine, steroid, and anti-allergy. So next is commonly occurring patients are asthmatic patients. They walk to your clinic for a dental treatment. When you take history, some patients say I have asthma. So asthma is such a thing. Even if the patient comes to you in stable form, it can precipitate anytime with any noxious stimuli or any dental treatment or anything can lead to the precipitation of the asthma. So basically, asthma is in line with allergy only. Airway edema and the bronchospasm. Okay? These two things are there in asthma you need to take care of. So treatment of asthma is to reduce the airway edema similar to as in allergy and to give bronchodilation. So in asthma, patient go to bronchospasm. The airway constricts. Patient feels like I am not able to breathe. So you need to treat that patient by giving steroid and bronchodilators. Steroid, as I already talked, hydrocortisone is the drug of choice for that, and bronchodilation. Bronchodilation, we have the option MDI inhaler, salbutamol. Asthalin is the trade name. So MDI is meter dose inhaler. That will take care of the bronchodilation. So you gave bronchodilator and the steroid. Steroid took care of the airway edema and the asthalin took care of the bronchospasm. So this is the primary treatment of asthma. The primary milder asthmas are usually response to this. Patients don't need further treatment, especially when you are taking up the patient at a dental clinic. You already know the patient is in stable form, and it will not lead to the deadly asthma. If the patient is already in spasm, already coughing, already wheezing, then you can lead, it can precipitate to the severe asthma. But in clinic, you already know the you know what patient you are going to deal with and which conditions these are in. So similarly, we have another option of injection, darifilin. Darifilin is a bronchodilator. If patient is not responding with the meter dose inhaler and steroid, you can give the injection darifilin also. That you have to give this slow IV, and you can give IM also. If you are not very much confident with the IV, you can give just IM. It will act in another 10 to 15 minutes. Patient will start responding. And tablets, prednisolone is also there. If you are not able to give the injection IV, then you can give the tablet prednisolone as a steroid also. Basically, your aim should be to manage the patient until the help arrives or any ambulance arrives. You should be equipped enough to do so, and you should have the knowledge of the drugs so that you can manage the patient till the help arrives. So next common thing in clinic is hypoglycemia. So diabetic patients, you know, they can walk to your clinic anytime, and in India, every third, fourth person is now diabetic. Obesity is there, diabetes is there. So this is a common occurrence. So you have planned extraction, or you may have unplanned extraction or any dental treatment. A diabetic patient comes to you at 10 a.m. without having any breakfast, and he took the morning dose of his oral hypoglycemic drugs also. He took the treatment for diabetes, but he has not taken any of the breakfast. So he tend to go into hypoglycemia another 1 to 2 hours. So this may happen at your chair also while doing the treatment. So first is the history part. Definitely, you always ask the patient, have you had something before doing any procedure? Definitely. But sometimes in busy practice, we miss such thing, and patient may land up in hypoglycemia at the chair. So basically, hypoglycemia is any sugar levels below 70. You can say patient is hypoglycemic and he needs some sugar by oral or IV if he's not responding, he's not in conscious state. So to treat hypoglycemia, we have kept glucon D powder, the routinely used glucon D powder. Just give 1 spoon or dissolve in half cup of water and give. Patient will respond immediately to it. Sometimes patient is sweating, anxiety thing is there, and patient tend to go unconscious also if sugar levels drop severely, especially in the elderly geriatric cases. So we have given an option of D25 that comes in form of 100 ml, like 100 ml NS you use at your clinic, that comes in form of that similar packaging, D25, that is dextrose 25. You can give IV and sugar levels will raise immediately. That in short is hypoglycemia. And drugs or management part is glucon D, simply available, and it's also available in our kit. And D25 you should definitely keep at your clinic to treat the hypoglycemia. So another complication or emergency that may arise is angina. Angina to hear, it's very fearing thing. Angina can precipitate. In those today's days, in post-COVID era, even young patients, even 35 to 40-year people are coming to us with a cardiac history, with angina, with low EF. And when we are doing the TMT and they are coming positive, and even the routine ECGs are showing the changes of cardiac issues. So angina treatment you can give is you have to treat the angina till the help arrives. Just keep your aims clear. You are not going to do any standing over there, nothing else. You have to reach the patient to the hospital so that he can be saved by the cardiologist. So what we have kept in our kit is tablet ecosprin, that is aspirin, 75 mg, 10 tablets are there. Tablet sorbitate is there in our kit. So, and what is angina? Patient may feel heaviness, patient may feel pain is being referred to the neck or shoulder. You will come to know that is a case of angina. Definitely anxious anxiety patients, all such things the angina patient can say. Simply you have to take the 4 tablets of aspirin and give it to the patient. That is 300 mg stat dose if it's confirmed that it's angina, and just 1 tablet of sorbitate below sublingual, below your tongue. Okay, you can keep. The patient will reach to hospital without any fearing complication, if not, if that is not very severe thing. So in short, we have covered the 2 drugs here, sorbitate and aspirin. Sorbitate comes in 5 mg tablets and aspirin comes in 75 mg tablet. We have kept both these drugs in our kit. So another drug is atropine. We as anesthesiologists, atropine is always loaded and kept on our anesthesia workstation because of syncope, because of bradycardia. Syncope is the most commonly occurrence issue your dentist can face in your routine practice, but they are not converting into the cardiac arrest. So what is syncope? Syncope is basically when you prick a patient, that is noxious stimuli to that can lead to the activation of parasympathetic system. What is parasympathetic system? It will bring down the heart rate, it will bring down the BP. So when heart rate and BP both are down, blood supply to the brain reduces. So there is cerebral hypoperfusion. So what syncope usually do is patient's BP is low, heart rate is low, and that leads to cerebral hypoperfusion. Blood supply to brain is not enough to maintain consciousness of the patient. That is called syncope. So how to treat that syncope? Mostly I see dentists using respiratory stimulants, ammonia. It works. Even if you don't give that, heart rate will revert as a response of the body. You can raise the legs of the patient. The venous pooling that's occurred in the lower limbs will return to the heart. BP will raise and the cerebral perfusion will increase. Respiratory stimulants are also doing the same thing. But issue comes when you have raised the legs also, you have given the respiratory stimulants also, then also there is no syncope is not going. You have to get your medical emergency kit, put the patient with the pulse oximeter, or you can just keep a hand on the pulse or on the carotid, see the patient is severely bradycardia or not. Here comes the use of atropine. Atropine will, if give IV, it will increase the heart rate immediately. So these syncopes which are not responding to your ammonia, not leg raising, head down, the venous return things, you have to give the atropine. Atropine is the most life-saving drug. If syncope is not treated, that will definitely lead to the cardiac arrest. Another is issue you usually face, usually not usually, but patient with complaints of epilepsy, seizures disorder can come to your clinics. So you can take history, you can ask the management part, you can see if the patient has taken routine medications or not. You can ask when was the last seizure. You can see the prescription of neurophysician they are following. What if seizure happens on your chair? you don't need to do anything, just you need to prevent the injury to the patient. If there is something in her mouth, you are doing RCT, any file is there, any your oral instrument is there, anything is there in the mouth, first you have to remove that if the patient is not clinching till that. Try to take them out immediately. Next step is to prevent the patient from injury. Seizure has come, you can't stop it, it will go, definitely go in few seconds, in few minutes. So your basic target is to prevent injury to the patient. He should not have any head injury by falling from the chair. He should not face any injury by your instrument. Definitely, you should also take care of. He should not damage your dental chair. All these things you should take care. Drug we have kept to manage. Phenytoin is the Aptoin name is there, trade name we have kept, but usually that's not needed. You can refer the patient to the hospital after the seizure is getting over. I think these covered almost all the drugs we are keeping in our clinic. Oxygen is the main concern, and usually dentists ask, should we keep oxygen or not? Actually, oxygen is a very important thing you should always keep in your clinic. We in our kit supply small 6-liter oxygen can that is of room freshener size. It can give oxygen up to 1 or 2 minutes, but we advise you to keep cylinders also. Oxygen may be needed anytime. Oxygen may be needed till the ambulance arrives. Oxygen may be needed if you need to transport the patient to the hospital in your car if the ambulance is not arriving. So oxygen you should definitely keep. One source of oxygen should be there. This almost cover everything. I think the drugs in dentistry. So I'll just guide you how to keep yourself ready for managing the emergency. Keep one thing clear, not only you, your staff should also be trained. If such emergency happens, you can't manage it alone. I, being an anesthesiologist, can't do anything alone. If my technicians are not there, my supporting staff is not there, or if I don't have any drugs or emergency or equipment. So you have to do the mock drills, regular mock drills. You can just mimic if one of your staff has a patient and he's going into one of the emergencies. So what should be your target? Definitely, first comes the scene safety. I am talking in terms of the basic life support. Scene safety. Scene safety, according to the dental clinic comes, we talked earlier, is your instruments, your RCT files, all these things should not be there. That comes scene safety. Any electric wire, anything should not be near to the patient. Assess for the response of the patient. If the patient is responding to you, if you're calling him by name, is he able to respond or not? Then call for help. Help can be the numbers you have noted of nearby clinic, any physician is sitting, any ambulance number, all these things should be ready below your table. And get your medical emergency kit or crash cart, anything you are equipped with. Then go for the checking of the pulse and breathing, these things. So regular mock drills you should be doing, and your staff should be trained enough that they know where is your emergency kit, where is your crash cart, and whom to call if such emergency is happening. So legally, you should be, definitely one attendant should be there. One attendant is always there with any of the patients. He should at least see not a panic dentist, not treating or not giving any support to the patient. So your target should be at least manage the patient till the ambulance arrives, and the attendant of the patient should see a dentist confident and equipped and ready to face such a complication. Your staff knows whom to call when such emergency occurs. Your staff knows where is your medical emergency kit, and your staff knows how to transport the patient to the ambulance, and you should know what drugs you should be ready with, and these all things should be there, I think. So I think demo, I have talked enough about the drugs and medical emergencies. I'll give a short demo of our medical emergency kit that's we recorded in 2017. We started, that's recorded in that time only. So we are playing that. Just have a look at the equipment and the drugs available in our kit. Hello everyone, this is a Onezoe medical emergency first aid kit bag. This is the front view of the bag and this is the upper view of the bag. In case of an emergency, this bag opens full so that it saves your time, precious seconds. This is NIDEC pulse oximeter. This is the best pulse oximeter available in market. You can switch it on from here and put it on your finger, and this will reflect your room air saturation and pulse rate. This is Oxy 99 6-liter oxygen can. This is basically only for first aid needs. We recommend you to keep a bigger oxygen cylinder with flow meters, but until that you should have at least this 6-liter can for oxygen. There is a nozzle on it. You can connect it to the oxygen mask and oxygen can be delivered to the patient. This is a nozzle for this. You should press it and oxygen will go directly to the patient through the mask. This is a silicone ambu bag. This is ambu bag. This is adult mask available with this. This should be connected like this. This is the reservoir bag that's come along with it, and this is the oxygen tubing. It should be connected here, and other end of the tubing should go directly to the oxygen cylinder. High flow oxygen cylinder is recommended to use with this, and this is kept on patient's mouth and you can give breaths like this. It's similar to mouth breathing. To avoid that, you can directly give resuscitation to the patient. This is a Milton medical first aid box. This is the best quality box available in market, and we have used it to keep all the medicine at one place. There are injections, IV cannulas, 3 options are there: micropore, others medicines like sorbitate, steroid, Avil, Glucon-D, syringes, Astelin inhaler, Hydrocot injection. Everything is available in this box. So these are best quality Omron BP apparatus, automatic, and this is Morpen stethoscope, and this is glucometer. These are 25 strips of glucometer that comes along with this. Lancets are inside this box only. This all things will be arranged in this bag and will come to you by a courier, preferably by Blue Dart or DTDC. And study material and a plaque. So that was the medical emergency kit. So thank you very much for your time, sir and ma'am, and hope I was able to do justice to your half hour of your precious time on Sunday, especially. Hello, I'm audible. Yeah. So thank you, Dr. Syed. I think you can continue with your another lectures.
So thank you, Dr. Amit. It was a wonderful presentation. Very nicely told about all the medicines that are available. We also have the kit that we have sent, the one
Okay.
I'm using. This is
Okay.
from Onezoe, so I'll show them here all the things that are available in it. And Dr. Amit has also agreed to give us a special discount of 1,000 rupees for all the upgraded participants. Whoever wants to order the kit, we will share the details with you. You can order it. It's a very comprehensive kit. You will have everything ready along with the study material, along with the flow charts and everything. So you are well prepared to handle all kinds of medical emergencies. So thank you, Dr. Amit, for this wonderful presentation.
Thank you very much.
Thank you.